Hi again. In this topic or in this discussion, we'll be talking about your corneal disorders. Okay, so the first corneal disorder that we'll discuss is your corneal dystrophy. So when I talk about corneal dystrophy, these are a group of disorders that are considered to be autosomal dominant. Okay, it's a dominant trait when it comes to our genetics. It manifests when the person is about 20 years old. Abnormal material. This is characterized by the build-up of abnormal material in the cornea. Okay, so recall that your cornea is the clear front window of your eye. Okay, so again, this is an autosomal dominant trait, which means that if either one of the parents would have the genes for the corneal dystrophy, there is a high tendency that it would be transmitted to the child. Okay, an autosomal dominant disorder would have about 50% tendency that it will be transmitted to the child at birth. Now, the corneal dystrophy would affect both eye, and the effect tends to be slow. And then if you would look at it, even though there is genetic implication in corneal dystrophy, its manifestation will only show up at about 20 years of age. So, what are the signs and symptoms for this patient? So, your patient would have decreased vision. Of course, cornea is having dystrophy. So, cornea is supposed to be the clear part of your eye. Because of that, there will be decreased vision. There is corneal edema. So, when I talk about corneal edema, your patient would manifest with bullous keratopathy. So, when I say keratopathy, there is formation of your blisters. Later on, these blisters would become painful and would appear to have discomfort once they are rupturing. And there will also be blurring of vision. So what is our treatment or what is our management for this patient? What we do is that we're using your bandage contact lenses. So your bandage contact lenses are designed to protect an injured or diseased cornea from the mechanical rubbing of the blinking eyelids and therefore allowing it to heal. So your bandage contact lens is a soft type of contact lens. Its purpose also is to flatten your bullae. Okay, it would flatten your bullae. So again, it is a soft contact lens. It would act like a bandage. So meaning class, it's a bit thicker. Okay, it would allow for corneal healing in such a way that you are preventing rubbing of your cornea, and even your blinking eyelids would not come in direct contact with your cornea. So the purpose of this is to allow for healing of your cornea. So what are the advantages, okay, of using your bandage contact lens? Using the bandage contact lens, you can apply medications, the eye can be observed, and then your patient could still see. Okay, other than applying or instead of applying an eye patch and then closing the eyelids, okay, this one would allow for examination of your eyes. And then other than that, your bandage contact lenses could also prevent the formation of your stagnant tear film during sleep. Okay, and supposedly this could cause fragile epithelial cells to adhere to the eyelid. But your bandage contact lenses is preventing that. Okay? Then for the symptomatic treatment, we are using your hypertonic drops, and we are using your ointment, which is such as, for example, your 5% sodium chloride. Then we also have your surgery for this patient. One is your corneal transplantation. In your corneal transplantation or corneal grafting. So what is done here is that the damaged or diseased cornea is replaced by the donated corneal tissue. So the purpose of this is to repair the corneal opacity and then remove or address the perforation of your corneal ulcer. Now, we're talking about corneal transplantation. So since this is a transplant, there should be a donor. So the usual donor class for your corneal transplant is a cadaver. And then immediate transplant is usually recommended. So, which means that that could be done within 2 to 4 hours from the death of your cadaver or from the death of the patient who will be the donor. It could be viable up to 12 hours if the body is placed inside the refrigerator. It could be viable. The cornea could be used within 48 hours if it is placed in a sterile container in a piece of gauze soaked in your normal saline solution at 4 degrees Celsius. So meaning it's almost freezing. Then we also have your penetrating keratoplasty. Class, when I talk about keratoplasty, remember kerato would refer to your cornea. So your keratoplasty would also include the full thickness, complete transplant of damaged or diseased cornea with a donor cornea. So your penetrating keratoplasty seems to be a type of your corneal transplantation. Okay, so corneal transplantation or corneal grafting or keratoplasty. Now, since we mentioned about the corneal donation, so your Philippines, just for you to be aware of also, is having the Eye Bank Foundation of the Philippines. So I've come across this while I'm searching for corneal transplant availability in the Philippines. Then, this is an organization that would actually facilitate the retrieval, processing, evaluation, storage, and equitable distribution of transplantable cornea and scleral tissue around our country. Now, we oftentimes say eye transplant, but when we talk about eye transplant class, usually we're only referring to the cornea and scleral tissue. Rare are the cases wherein the actual eye or the entire eye of the patient would be transplanted to another patient. Okay? So if you would want to access the website, here's a QR code that I've created for that website, just in case you're interested to access such. Then the next problem that we have is your keratoconus. Okay, kerato, cornea, conus, cone. So let's see what happened to this patient. In your keratoconus class, this is characterized by a conical protuberance of your cornea with progressive thinning on protrusion and irregular astigmatism. So what happens if this is your healthy cornea, okay, as shown here on the one that I'm highlighting on. So if this is your healthy cornea, what happens in your keratoconus cornea is that there is exaggeration of the cone formation here or protuberance. So what happens? There is progressive thinning. Okay, the part of the cornea that protrudes here would be thin, and then the tendency is that there will be astigmatism on the part of your patient. So hence your patient is having corneal problem plus a refraction problem. Now, what are the assessment findings for this patient? So the signs and symptoms of this patient will be that like of your astigmatism. So one, your patient would have corneal scarring. Okay, scarring because remember there is thinning. Then your patient would have blurred vision. There is distortion of vision with multiple images, and then their tendency is that they would have photophobia. Okay, in other words, no, they will be they will be afraid of intense exposure to light. Okay, so if this is the normal vision, their vision will have a tendency to appear with multiple images. Okay, and there is exaggeration of lights. Okay, seems to be halos around lights. So, this is also a distortion of vision with multiple images. So if this is your normal vision class, your patient with keratoconus would have the initial stages such as this. Okay, there's ghosting. Okay, ghosting in such a way that there are shadows behind the actual character. And then on the later stages of your keratoconus, there will be complete distortion when the contact lenses are not worn already by the patient. So actually retrieve this image online. Okay, so what is the treatment for this patient with keratoconus? Remember, we have enlargement or excessive conization of your cornea. What are we going to do? So what we're going to do is that we use the rigid gas-permeable contact lenses. Okay, so this one is the scleral lens for very big cone. Then you have your hybrid lens for the moderate to big cone. Then you have the RGP for mild cone. Okay, so class, the purpose of this is to provide satisfactory visual quality and improve the regularity of the corneal surface. So this is with the hope that later on, if you are starting with this type of your contact lenses, okay, you can later on move to this type until you will be using this type. Okay, with a gradual reduction of the size of your cornea or the gradual restoration of the shape of your cornea. If this will not be able to manage your condition, a penetrating keratoplasty will be recommended for your patient. Okay, so this is actually a study that would show the effect of rigid gas-permeable contact lenses on our keratoconus progression. Okay, so this study has found out that it is indeed effective. This was a study published in 2020 in the International Journal of Ophthalmology. Okay, so this is the conical cornea, okay, that is characterized in keratoconus. And this is an example again of a gas-permeable lens which is used for keratoconus. Okay. Next, we have your corneal scar and opacities. So your corneal scar and opacities would create vision problems. Okay, it would affect the clarity of vision and create vision problems. It may be caused by the scarring of your cornea, may occur as a result of various conditions, including your injuries and even your infection to the eye. Okay, so corneal scarring and opacities. assessment. And your right is actually a severe form already of opacity. Okay, so there's decreased vision, vision loss, feeling of something in the eye initially, then there will be light sensitivity, unexplained eye redness, eye that looks cloudy or milky. Okay, so what is our treatment for this patient? So usually class oral medications or steroids are given to this patient if there is involvement of inflammatory processes. Antibiotic eye drops are used if the cause is infection. If not class, if could not be managed by these medications, you'll be using your laser surgery or corneal transplant. Okay, which is actually recommended if the condition is already more serious. Then we also have your ocular melanoma. Plus, your ocular melanoma is the most common malignant eye tumors in adults. The tumors would occur most often in the uveal tract among people in their 30s and 40s. So remember when I talk about your uvea, okay, your uvea is the middle layer of your eye. Okay, it is the middle layer of your eye, which lies beneath the white part of your eye, which is your sclera. Okay, and then so your uvea is actually where your iris, your ciliary body, and your choroid could be found. So your problem in ocular melanoma is that it commonly occurs in your uveal tract. Okay, so class it would appear like this. So these are already melanomas. Okay, abnormal growth. Now, what is the assessment? Of course, there will be blurring of vision, reduced visual acuity. The more pressing problem is the increase in your intraocular pressure. Okay, the increased intraocular pressure can lead to glaucoma. Okay, so that's the more pressing problem. There will be a change in the color of the iris as shown in the previous slide. You could see that there is brownish discoloration there already. Then there could be a sudden loss of a portion of the visual field. Okay, the sudden loss of the portion of the visual field may be related to the compression of your melanoma to your optic nerve already. Okay, if there is enlargement and there is compression of the optic structures already. So recall our discussion in visual fields. So for example, if the melanoma is on your right eye, it may be possible that your right visual field or your left visual field of your right eye may be damaged. Okay, so recall again that there are two visual fields in either of your eyes. So either of these can be damaged. Then, what is our diagnostic test for this patient? So you'll be doing your eye ultrasound. So class, this is an example of eye ultrasound. So as you can see, this is a non-invasive test actually that would use an eye probe, okay, to detect the sound waves or get the sound waves coming from the eye and then later on form an image of an ultrasound. Okay, so from this ultrasound, we are showing the nasal view and this is the temporal view, okay, of the eyes. Okay, this is the right eye ultrasound. So that's one test that can be used. Okay, so what is the management for this patient? Surgery could be done. Okay, surgery, enucleation, so removal of the eyes. Then you can have your radiation therapy since we're doing with abnormal growth here. Okay, your cycloplegic eye drops may be able to help in visualization of the melanoma on the internal structures. Okay, and then you can have your antibiotic steroid combination. So antibiotics, okay, remember that we have antibiotics that can be used to resolve your cancer. Okay, and then we also have your steroids to reduce the inflammation experienced by your patient. On the next discussion, we'll be already focused on intraocular disorders. One example of which is your cataract. And then after that, we'll be talking about retinal detachment. Thank you for your attention.